Chances are you know someone who suffered a stroke. In fact, listen to this. 1 in 4 Americans dies from stroke every 4 minutes. Staggering. Surviving a stroke can have severe challenges, too, often leading to a life of serious long-term disability. So let's talk about this. Dr. Louise Mccullough is a neurologist and director of stroke research at the UConn Health Center. Good morning. Thank you for coming in. Clearly, this is something we all need to talk about. No better time. May is Stroke Awareness Month.
Correct. So we do try and get out there and do a lot more public awareness about what risk factors you should be treating to help prevent a stroke.
So you touched on two things. First of all, what are the risk factors?
So the biggest risk factor is high blood pressure. So by far the probably the highest, the thing you could probably do best is control your blood pressure. We used to think blood pressures of 140, 150. Patients would say, oh, that's not that bad. It's only when I'm seeing you with the white coat.
Right,
and it turns out blood pressure should be more like 120 over 80, and that's now our goals. So we've changed our goals downwards.
And in terms of preventing, because there are a lot of people in this country that deal with high blood pressure, a lot.
Yes.
It's not uncommon at all.
Especially, so I study stroke in women, and over 75% of women over the age of 60 will have hypertension. 75%. Yes. So.
Well, no wonder the number is 1 in 4 then, because this is something you associate with an older population.
Correct. I mean, that's not to say that young people don't also get stroke, and we have to always keep those in mind, because otherwise they'll come to the emergency room and they're often not recognized as a stroke. And since we have very limited time window to treat patients, we need to kind of assume that everything's a stroke until we prove otherwise. But it really is a disease of the elderly population. For every 10 years after the age of 55, your stroke rate doubles. So 65, 75, 85, each is a doubling.
We're going to get to prevention so we don't leave everyone feeling hopeless and terrified in just a minute, but I want to touch on the fact that you're doing some research that looks at strokes in women and men. First of all, it affects the sexes differently.
It does.
And there's also something that may indicate that hormones play a role here.
Exactly. And we know some of the risk of younger patients getting strokes, for example, are things like the birth control pill, which does have a slightly higher increased risk of stroke if they're on hormone therapy or birth control. But most of the patients who suffer stroke are after the menopause. But we know women have lower rates of stroke, lower incidence of stroke, and lower rates of blood pressure until after the menopause, which in America is about the age of 51.
And things start to change. And when women have strokes, it's more debilitating to women than men.
Exactly. So more women end up in nursing homes, more women end up with cognitive disability, and about 1 in 3 end up having to be dependent on another person.
What are the symptoms? How do we know we're having a stroke?
So probably the most important thing to think about is focality. It seems like a weird word, but symptoms on one side of the body.
Okay.
So numbness or weakness on the arm, face, or leg, but really on one side of the body, not both sides. Trouble with confusion, sudden onset of trouble speaking or understanding speech, difficulty with your vision, or feeling of unsteadiness can also be a sign of a stroke.
It all sounds kind of dismal. How do we prevent ourselves from finding ourselves more susceptible to stroke?
So the big thing is to watch your risk factors. Things like obesity, diabetes, cholesterol, all of those are treatable. And if you treat your cholesterol and you treat your blood pressure, it's like you don't have those risk factors anymore.
Really? So the drugs are that good?
If
you're given those drugs?
Yes, if you take them.
And
that's always difficult. And blood pressure can be very difficult because it's a silent disease. So people get more symptoms from taking blood pressure meds than they do from the blood pressure. So they're like, oh, I'm not going to take the medication. I feel worse on it. But it's very, very important to take those. And importantly, we have one drug to treat stroke, but it has to be given within 3 hours of symptom onset. So you have to get to the emergency room fast, and we do find women tend to take longer to get to the emergency room. Maybe they don't want to call 911. They
we're
don't
used
want
to
bother.
being in pain.
Exactly. So they ignore it.
We're hardy.
Exactly.
We're tough,
They're like, oh, I don't want to put anybody out.
What's new?
Exactly.
Right.
But 911 for sure.
All right. Thanks for the crash course. We appreciate it. Dr. Louise Mccullough, really, really appreciate it. Good time to talk about it. Again, May is Stroke Awareness Month. Thanks.
Excellent.